Hi, I'm Matt Najad, and today I'm going to be talking about biomimetic materials and material reactivity testing. A lot of our patients are concerned about the materials that go into their mouths, rightfully so, and it's very important that you know your options which are available to help you pick the best materials. I have a lot of patients always asking about the materials, and while every material I use is in the most compatible and well-tolerated range of materials, there is no perfect material for every single patient. So we'll get into the reactivity testing, but I also want to kind of go over the summary of the important criteria for the biomimetic approach. So taking a look at this, we see that biomimetic dentistry is about biology, which means keeping your tooth alive, function, which means replicating the natural function of your tooth and how it's shaped, how it looks, how it's the strength and everything like that. Biomechanics, which is also like having to do with how stresses are distributed through the teeth during different motions and clenching and grinding and biting. And then aesthetics, which is how the tooth looks. That combination of things is what biomimetics is about, and it's trying to replicate your tooth. The materials we select are the ones that best do that, but none of these specifically mention the least reactive, because not everybody is the same and there is no perfect material for every single patient. The materials I use on a daily basis are in that range of tolerable for most patients. If you're concerned about materials and you want something more precise or more specific, that's when reactivity testing has a place. On a natural tooth, we have the enamel, the dentin, and the DEC. These are three different layers that we're trying to replicate. And all the materials that I use are the ones that are suited to best replicate these different things and achieve our goals so that we can get a biomimetic result. On a typical day-to-day basis, I'm using so many different materials, including adhesives, composites, cements, primers, restorative materials such as ceramic, and all these have different options. However, in order to get the perfect balance of the biomechanics, biology, function, and aesthetics, I can't take any individual material and achieve the ultimate result in every single category, because what we're trying to do is get the merging of all these different things right in the middle so that we get the total biomimetic result. So when we look at materials, I try to use what I know works well. If you're sensitive to materials, or you know you're sensitive to materials, or even if you're concerned about sensitivity, my recommendation is the Clifford reactivity test. I don't think that everybody needs to get this test, but if it's something that you're heavily concerned about, I think it has a place in helping us select materials that may work for you. The Clifford material test looks at your reactivity to 94 different groups of things. And these 94 different groups are major functional groups that are in dental materials and all materials, and it looks at how your body reacts to them. And it's used as the basis for determining if you are or you're not suitable for a certain material. It's not literally testing your body against every single dental material. It finds if you're reactive to, say, this metal or this acrylic, and then it can look and compare that against the database of all the known dental materials that are in their database and say that you're suitable for these groups and not for these other ones. It's very important to notice that it does not specifically indicate compatibility. This is looking, the Clifford test is looking at your body's reaction to these materials. It's not an indication of compatible. It's not very easy or realistic to actually indicate compatibility or prove compatibility, but if your immune system responds to a material and produces a lot of antibodies, it's a sign that it's not a great material for you to use. And if there's alternatives that don't do that, then it's probably a good selection to do, a different material. But sometimes if there's nothing that's suitable, you have to pick between, your options, and that's been very rare. I haven't really encountered a situation where we're not able to restore a patient because of this, but it is a possibility. It's a very reliable and precise test. The process is that either your doctor or your physician will order a blood test. Sometimes they can take it themselves, other times they work with a local lab or a phlebotomist to draw your blood. And then this is sent to Clifford Lab for testing. And then the results come back and you're able to review it with either your physician or your dentist if you're talking about dentistry, and you can determine which materials are going to be compatible. I shouldn't say compatible, which materials are not creating a big reaction to you. And if it's low reactivity, then you're suitable for that. This is the typical results of the test. So you get a PDF document that includes both a summary of which groups have high reactivity for you or other ones that are lower, and then it also shows you on a material basis, like every one of these is an individual material, and it goes through this list and says suitable or not suitable. So your dentist is able to say, I want to use these materials, are they suitable? If they're not, can I find an alternative? And the thing I want to emphasize here is that I can't get a biomimetic result with any material you give me. If you say use this, 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 and this, I can tell you that maybe that's not going to work and the tooth is going to fail and you're going to have cavities because I can't get the right bond. So it's important to have a compromise among all different criteria, but so far I've been fortunate because if a patient was not suitable for like this adhesive, my other adhesive that I know is really, a good material and has excellent results, that one was still possible. So most of the time we can pick from the different materials that I am comfortable with, knowing that they will succeed. But there's times where if a patient's not going to be suitable for any of these different adhesives, then maybe the long-term result will be jeopardized too. So I always say there's no perfect answer to any of these things. You might get the least reactivity to one material, but then you also get the lowest bond strength, lowest sealed, most likely fracture of the material. So there's a lot of different properties to balance. This test is a really good way to screen yourself. So in summary, I want you to know about the Clifford Material Test. It's a great way for you to look at your reactivity to different materials, and it has a great place in helping you pick different materials that will work for you, but there is no perfect answer for every single patient, and this is only for the patient that is highly concerned about the sensitivity to different materials. I hope you found this section on the material reactivity testing useful. It's something that patients are asking me all the time, and I want to make it useful for you and help you make the right decisions that are the best for you. Thank you for watching.